Hello everyone, welcome to the Chameli Devi Institute of Pharmacy, Indore. In this presentation, we are going to discuss about diabetes and its treatments. In this presentation, we will discuss about introduction to diabetes, its type, symptoms. Diabetes is a metabolic disorder, its treatment, and some key aspects. So, if we are talking about diabetes, then first we should know about what is diabetes. According to doctors, diabetes mellitus or diabetes described as a group of metabolic diseases in which the person has high blood glucose or blood sugar level either because of insulin production is inadequate or because the body's cells does not respond properly to insulin, or maybe both type of conditions. Patients with high blood sugar level will typically experience polyuria, which means frequent urination. They will become increasingly thirsty, which is also known as polydipsia, and hungry, which can be termed as polyphagia. Types of diabetes. Diabetes having four major types: type 1 diabetes, type 2 diabetes, gestational diabetes, and pre-diabetes. So, if we are talking about type 1 diabetes, the body does not produce insulin in this kind of diabetes. Some people may refer to this type of diabetes as insulin dependent diabetes, juvenile diabetes, or early onset diabetes. People usually develop type 1 diabetes before their 40th year, often in early adulthood or teenage years. Type 1 diabetes is now very near as common as type 2 diabetes. Approximately 10% of all diabetes cases are type 1. Patients with type 1 diabetes will need to take insulin injections for the rest of their life. They must also ensure proper blood glucose level by carrying out regular blood tests and following a special diet. For the same type 2 diabetes, the body does not, in this kind of diabetes, the body does not produce enough insulin for proper function, or the cells in the body do not react to the insulin, or maybe insulin resistance. Approximately 90% of all cases of diabetes worldwide are type 2. Some people may be able to control their type 2 diabetes symptoms by losing their weight, following a healthy diet, doing plenty of exercise, and monitoring their blood glucose level. However, type 2 diabetes is typically a progressive diabetes. It gradually gets worse, and the patient will probably end up have to take insulin, usually in tablet form. Overweight and obese people have a much higher risk of developing type 2 diabetes compared to those with a healthy body weight people. People with a lot of visceral fat, also known as central obesity, belly fat, or abdominal obesity, are especially at a risk from the type 2 diabetes. Being overweight or obese causes the body to release chemicals that can destabilize the body's cardiovascular and metabolic system. So, being overweight, physically inactive, and eating the wrong foods all contribute to our risk of developing type 2 diabetes. If we are talking about the third kind of diabetes, which is gestational diabetes, this type affects females during pregnancy. Some people, some women have very high level of glucose in their blood, and their bodies are unable to produce enough insulin to transport all of the glucose into their cells, resulting in progressively rising level of glucose. Diagnosis of gestational diabetes is made by during pregnancy. The majority of gestational diabetes patients can control their diabetes with exercise and diet. Between 10 to 20% of them will need to take some kind of blood glucose controlling medications. Undiagnosed or uncontrolled gestational diabetes can raise the risk of complications during pregnancy. Now, the pre-diabetes. So, what do you mean by the pre-diabetes? Patients with patients with type 2 diabetes initially had a pre-diabetes. Their blood glucose level were higher than normal but not high enough to merit a diabetes diagnosis. The cells in the body are becoming resistant to insulin. This kind of diabetes is also known as pre-diabetes. In this slide, we are going to discuss about common symptoms of diabetes. People can often have diabetes and be completely unaware of that. The main reason for this is that the symptoms, when seen on their own, seem harmless. However, the earlier diabetes is diagnosed, the greater the chances are the serious complications which can result from having diabetes can be avoided. So here I have mentioned most common diabetes symptoms. One of them is frequent urination. Have you been going to the bathroom to urinate more often recently? Do you notice that you spend most of the day going to the toilet? When there is too much glucose or sugar in your blood, you will urinate more often. If insulin is ineffective or not there at all, your kidneys cannot filter the glucose back into the blood. The kidneys will take water from your blood in order to dilute the glucose, which in turn fills your bladder. Second symptom is disproportion of thirstiness. If you are urinating more than usual, you will need to replace the lost liquid. You will be drinking more than usual. Have you been drinking more than usual lately? Other than that, intense hunger is the common symptom of diabetes. As the insulin in your blood is not working properly or it is not there at all and your cells are not getting their energy, your body may react by trying to find more energy. Food. You will become hungry. And unusual weight loss. This is more common among people with diabetes type 1. As your body is not making insulin, it will seek out another energy sources. Muscles, tissue and fat will be broken down for energy. As type 1 is of a more sudden onset and type 2 is much more gradual, weight loss is more noticeable with type 1 kind of diabetes. Blurred vision. These can be caused by tissue being pulled from your eyes lenses. These affect your eyes' ability to focus. With proper treatment, these can be treated. There are severe cases where blindness or prolonged vision problem can occur. Other than that, numbness or tingling, especially in your feet and hands. If there is too much sugar in your body, your nerves could become damaged, as could the tiny blood vessels that feed those nerves. You may experience a tingling and numbness in your hands and feet. Other than that, more skin and yeast functions Where there is more sugar in your body, its ability to recover from infection is affected. Women with diabetes find it especially difficult to recover from bladder and vaginal infections. Other than that, itchy skin, a feeling of itchiness on your skin is sometimes a symptom of diabetes. Uh, Fatigue is the most common symptom of diabetes. If your insulin is not working properly or is not there at all, glucose will not entering your cells and providing them with energy. These will make you feel tired and listless.
Diabetes is also considered as a metabolic disorder. So we should know about why it is considered as a metabolic disorder. Diabetes is classed as a metabolic disorder. Metabolism refers to the way our bodies use digested food or energy and growth. Most of what we eat is broken down into glucose. Glucose is a form of sugar in the blood. It is the principal source for the fuel of our bodies. When our food is digested, the glucose makes its way into our bloodstream. Our cells use the glucose for energy and growth. However, glucose cannot enter our cells without insulin being present. Insulin makes it possible for our cells to take in the glucose. Insulin is a hormone that is produced by the pancreas. After eating, the pancreas automatically release an adequate quantity of insulin to move the glucose present into our blood into the cells. As soon as glucose enters the cells, blood glucose level drops. A person with diabetes has a condition in which the quantity of glucose in the blood is too elevated, or we can say it hyperglycemia. This is because the body does not produce enough insulin, produces no insulin, or has cells that do not respond properly to the insulin the pancreas produces. This results into much glucose building up into the blood. This excess blood glucose eventually passes out of the body in urine. So even though the blood has plenty of glucose, the cells are not getting it for their essential energy and growth requirements. Diagnosis of diabetes. So, how to determine whether you have diabetes, pre-diabetes or neither? Doctors can determine whether a patient has normal metabolism, pre-diabetes or diabetes in one of three different ways. There are three kind of tests are uh, doing for the diagnosis of diabetes. First one is the A1C test, second is the FPG test, and another is the OGTT test. If we are talking about the first test, which is A1C test, in this test our values are comes at 6.5%, then it means patient is diabetic. If values comes between 5.7% and 5.99%, that means it is a pre-diabetic value. If it is comes between less than 5% value, then it is a normal value. Now, second test is the FPG test, which is also known as fasting plasma test. In this test, if value comes 126 mg per dl, means patient will be diabetic. If values come between 100 mg per dl and 125.99 mg per dl, means it is a pre-diabetes. And if values come less than 100 mg, then it is a normal value. Last test is the OGTT test. This is the oral glucose tolerance test. In these tests, at least 200 mg per dl means it is a diabetes. If values come between 140 and 199.9 mg per dl, then it is a pre-diabetes. or these values are comes for the pre-diabetes. Rather than that, if values come less than 140 mg per dl, then it means a normal value or normal diabetes. Now, the treatment of diabetes. Anti-diabetic medication is referred as a treatment for diabetes. Drugs used in treatment of diabetes mellitus by lowering the blood glucose level. These are administered orally and are thus also called as a oral hypoglycemic agents or oral anti-hypoglycemic hyperglycemic agents. There are different classes of anti-diabetic drugs and their selection depends on nature of diabetes, age and situations of the person as well as other factors. Diabetes therapy is not only about lowering glucose level but also about the overall complications such as blood pressure and blood lipids. These requires lifelong care and management. People with type 2 diabetes often require oral drugs and sometimes insulin is used to control their blood levels. If we are talking about insulin, then we should know about its structure or its chemical properties. So insulin is a small protein which contains two chains, which is A and B chains, which are further linked by disulfide bridge. Insulin is released from pancreatic beta cells and at a low basal rate and at much higher stimulated rate in response to a variety of stimuli, especially glucose. If we are talking about chemistry of insulin, then it consists of two open polypeptide chains A and B. There are 21 amino acids in chain A and 30 amino acids in B chain. Two chains are interlinked by a disulfide bridge. There is an additional disulfide bridge between the 6th and 11th amino acid residues of the chain A. Breaking of disulfide bridge inactive insulin. It is protein in nature and its molecular weight is 5800. So here is a classification of hypoglycemic agents, or we can say anti-hyperglycemic agents, or we can say anti-diabetic agents. It is classified in two categories, parenteral and oral. Parenteral is further classified into fast acting, intermediate acting, long acting. And oral is classified into two categories, sulfonylureas derivatives, biguanides derivatives. Classification of insulin. Insulin is parenterally administered into the body as a hypoglycemic agent. This is considered into three categories, short acting, intermediate acting and long acting. Short acting insulins may be soluble, regular or natural. Intermediate acting insulins is isofen or insulin zinc and long acting insulins are crystalline insulins. Rather than that, oral hypoglycemic agents are sulfonylureas and biguanides. Sulfonylureas having two categories, first generation and second generation. There are some drugs of first generation which is tolbutamide, chloropromamide, acetohexamide. These are amide derivatives. Second generation sulfonylureas are glibenclamide, glipizide and glicazide. Biguanides are having metformin, fenformin and buformin. Now there is a first class sulfonylureas. So its chemistry says sulfonylureas are chemically related to the sulfonamide structure because it is having a sulfonamide moiety in the structures. The compound are aryl sulfonylureas with substitution on the benzene ring and urea group. The basic structure is given here. Substitutions are present on the R1, and the main moiety is sulfonylureas, which is, you can see here, sulfonamide moiety is present, as well as urea group is connected with the chain. SAR of sulfonylureas, or structure activity relationship of sulfonylureas. Activity and potency of sulfonylureas change with the introducing of new group on the substituent value to the basic structure of sulfonylureas, called as SAR of sulfonylureas. So you can see here the substitutions at R1 and R2, which gives further category of drugs like tolbutamide, chloropropamide, acetohexamide. There is a substitutions on R1 and R2 are responsible for the antidiabetic activity or anti-hyperglycemic activity. If we are talking about the mechanism of action of sulfonylureas, then these drugs binds at and decrease potassium channels to the entry of beta cells. Then it produces depolarization, as well as increases calcium ion entries, and it can release from the insulin can release from the beta cells. If insulin is released, then it breaks down the glucose level and gives action as an anti-diabetic action. Now, second hypoglycemic agent is biguanides. Biguanides are a class of medications used to treat type 2 diabetes and other conditions. These drugs work by reducing the production of glucose from digestion. Metformin is the only biguanide currently available in the most countries for the treatment of diabetes. Biguanide stops the liver from making extra sugar when it's not needed. If we are talking about chemistry of biguanides, then these drugs or compounds in which the amidine moiety is directly bonded to the guanidine moiety at N2 position to form C double bond N conjugate system. So here is a structure of metformin and fenformin. If we are talking about the mechanism of action of biguanides, then how it works in a body, then biguanides are directly stimulate glycolysis in peripheral tissues with increased glucose removal from blood, reduce blood sugar level or blood glucose level by reducing hepatic glucose neogenesis, reduce intestinal glucose absorption, enhancement of insulin receptor binding site. There are some key aspects of diabetes which we should consider or conclude in the end of this presentation. So, first aspect is diabetes is a long-term condition that causes high blood sugar levels. In 2013, it was estimated that over 382 million people throughout the world had diabetes. Type 1 diabetes, the body does not produce insulin. Approximately 10% of all diabetes cases are type 1. Other than that, type 2 diabetes, if we are talking about type 2 diabetes, the body does not produce enough insulin for proper function. Approximately 90% of all cases of diabetes worldwide are of these types. Gestational diabetes. This type affects female during pregnancy. The most common diabetic symptoms included frequent urination, intense thirstiness and hunger, weight gain, unusual weight loss, fatigue, cuts and bruises that do not heal, some sexual dysfunctions, numbness and tingling in hands and feet. If you have type 1 diabetes or one type of diabetes and follow a healthy eating plan, do adequate exercise and take insulin, you can lead a normal life. Type 2 patients need to eat healthy, be physically active and test their blood glucose regularly.
They may also need to take oral medications and insulin to control blood glucose levels. So we just have here has concluded all these points for the diabetes and its treatment and its prevention or monitoring. Thank you for watching the presentation.